I am super excited to be here on this Wednesday, The Shot, and I'm Eugene Borhovich, a co-host of The Shot of Digital Health Therapy. Welcome, Jim Joyce.
Very good. That was the first time we didn't get a proper proper Jim Joyce to start with.
I
I'm a
didn't
little.
even I
I don't
didn't
know how
even
to react.
practice, but wait, hold on, but we're gonna miss this. Jim Joyce.
There
There
we
you go.
go. There we go.
That's
There we
more
go.
like it, right? Let's not produce.
Happy Wednesday. Happy Wednesday. You have been on the move. You're back from ATA. When's your next
Yeah.
conference, Eugene?
Honestly, we definitely will be at the Health in Amsterdam. But
Awesome.
at the end of the day, it was just, we're so laser focused on US, and so a lot of the trips are just more kind of meetings and setting a bunch of stuff
Yep.
up. So probably gonna be back out there again in the next couple of weeks. But
It has the mood and the dynamic when you're in the U.S. on these meetings. People are moving and
yeah, I mean, look,
shaking.
I
They're
started with
calculating.
I think you kind of keep hearing hashtag tough market everywhere, right? I mean, just
Yep.
everything from decision making process. ATA I think was a bit special just because of some of the things that just been happening in the marketplace, which we was kind of talked ad nauseum on stage. But Optum Health shutting down, virtual care, right? Not
Right.
Optum, virtual care
Walgreens.
unit and Optum. Thank
Yeah.
you. Then
Walmart.
Walmart Health, and then obviously the depressed stocks, right? Just in
Sure.
the telemedicine space. But given all that, and I did a quick short post, the mood is really, like it was pretty amazing to see the energy still of the people and the drivers and the innovators. So I think
Yep.
overall good. And look, the reality is there's just not enough, access to care is still hard to come by, right? People,
Yep.
while getting more concentrated around the cities, in rural locations. So lots of stuff going on, but yeah, no, excited to be back for a bit, and excited to be back. Episode, I think 139, and we have
I
an
think
awesome guest today.
let's
I don't
bring
know.
let's
Do we
bring them
want
in.
to talk news? No, right? I don't know.
No, no, I think let's
We
let's
got
let's
news
go right.
coverage elsewhere. Yeah,
Yeah.
let's. All
Let's
right,
go to the guest.
so let's let's bring Bryan in. Bryan is another American living now in Europe and traversing the pond, I think every couple of weeks. Welcome, Mr. Sivak. Have you met Jim, by the way, in passing at least?
I
Yeah.
don't think so.
I don't think so. Nice to meet you, Brian. Great to see you. Where do we find you?
You find me on the southwest coast of France at the moment.
Ooh, hard life.
So we
Yeah,
Hard
can't
life.
got
complain. Can't
we
complain.
got Dublin, Barcelona, and south coast of France, right? So there
Excellent.
you go. Amazing. Well, welcome to the shot. And I actually looked this up because Bryan, I know, we've been kind of just chatting, and honestly, like I feel like I've known you my whole life, but I actually had to look it up. We got introduced by Isabel from Pomelo Care just on, I looked it up, 2/2/22 on February 2nd of 22nd, which is not that freaking long ago. It's literally like 2 years ago. So
No, but it's been
Right.
a long 2 years.
that is also
Right.
true. That is
Right.
also
Right.
true.
Right. Kind of
Uh,
dog years.
but anyway, well, so I think I gave you a little heads up, even though not much. And that's the beauty of this meticulously unproduced show that we have, is that we have no agenda. It's just getting to know the person. And so, would love for you to take our millions of listeners and viewers through your life, wherever you want to start, whichever part of the journey, and we'll interrupt rudely as we go through
You can
All
start with
right.
maternal care, right? Neonatal
it.
maternal care if you want.
I don't really remember too much about that, so I'd be making a lot of it up. But yeah, I mean, I guess where do I start? Born in California, lived there for all of 6 months. My dad's actually a physician. He was doing his residency at Stanford when I was born. And then 6 months later, they threw me and the dog in the car and drove to the East Coast. And basically grew up in Connecticut until 18. Went to Chicago for school. University of Chicago was a computer science major, which for the University of Chicago, for those of you who know, is one of the strange, very practical majors that
Okay.
the university offers. It's a theoretical version of a practical major, but anyway,
I think we may
graduated
need
from
like a
there.
whole 10 minutes just on that alone, but we'll put that to the side.
I love that
Yeah,
statement
Yeah.
already. Theoretical version of the
well,
practical major.
Chicago is an interesting place, and actually has been in the news recently. I don't know if you guys have been paying attention, but there's this thing called the Chicago Principles, where they've outlined their view on what free speech on campus means, which
Mm.
I'm actually very proud to say I agree with it. And a lot of it has to do with universities being a place to challenge thought. And if you're worried about trigger warnings and things like that, Chicago's not the place for you. But
Right.
it's a really interesting statement for those of you who are interested in that stuff. So I would recommend checking it out. But anyway,
That's
was at Chicago. Actually, was on the 5-year plan. I took a year off in the middle of school to become a ski bum in Colorado for a year, which was
why not?
wonderful. Uh, I mean, it was taught me a lot actually about what I was interested in, what I wanted to do. Can't complain about that at all. And then when I graduated, moved out to California with a freshly minted degree in computer science, and ended up doing what pretty much everybody in the late 90s with a freshly minted degree in computer science did in San Francisco, which was decide to start a company, not knowing literally the first thing about what starting a company actually meant. I joke sometimes that I didn't know how to spell ROI, and it's actually not really a joke. I remember the first time I heard that term, and I was like, "RO what?" And it was interesting. We started this company in the late 90s, sort of ran up the dot-com boom, and then saw the dot-com bust. Made it
And
through all of that.
and what was
Um,
the company
lots
doing?
It was a company called Inquira. We basically, well, it was sort of we had some iterations. The first thing we did was we built the first ever natural language based search engine on the web. So, this is back in the days, if we're really dating ourselves here, but the days of Alta Vista and Lycos and all of
Yeah.
that kind of
Was
stuff.
was the
And if you
Hey
guys,
Jeeves? What was the Jeeves one or
Ask
something? What was that?
Jeeves.
Ask Jeeves. Yeah.
they came after us actually, but basically back in those days, you would just type in a bunch of keywords, get some blue links back. And what we decided to do was allow people to ask questions in English, and then use those search engines sort of as our backend to process the results, and try to display more accurate and complete answers. So like
So you were
if
the
you said something like,
OG OpenAI Chat GPT.
so yes, and it's sort of interesting because we actually open sourced some of our
Huh.
natural language processing libraries, which I believe were still being used by people up until like the mid 2010s. So it was actually kind of crazy.
Cool.
And we were sort of the OG from that perspective. But obviously the world has changed quite a bit since then. And so, things are different.
By the way,
Um,
Brian, sorry to interrupt. If any of our kids, and I know we have a range of ages, are watching this and are gonna hear some of the brand names, they'll be like, "What?
I
What are
know.
you guys?
I
What are
mean,
you old dudes talking about?"
I was actually telling I have a 15-year-old daughter, and I was telling her the other day about when I got my first cell phone, which was in 1999, I think, maybe even
Yeah,
2000. And she was like, "Well, what did you do before that?" So
good
we're definitely
question.
living in a different era these days. Anyway, so we built that company. Like I said, went through lots of ups and downs. Plenty of times where we were, well, not plenty, a few times where we were a couple of weeks away from making payroll. Made it through all of that, and eventually ended up selling the company to Oracle. In 2005, I actually moved to London to build the international business, and grew that to about 40% of the company's revenues, and had a great time doing it. Um, After we sold the company, we had just had our first kid, and we're thinking about heading back to the US just to be closer to friends and family. And um, it's a bit of a longer story, but the short version is that I was sort of randomly recruited by the mayor of DC to be the chief information officer for the city. And I'd always been interested in public service. There was just something kind of compelling about it, and ended up taking that job. And we moved back to the US, we moved to DC. And that led into uh, a few different government jobs. So started off as the CIO for DC. Learned what happened in that role when your political sponsor loses their election campaign, which
Right.
is not that you get fired, but that you submit a letter of resignation, which is then summarily accepted. Um, if you or any of the millions of listeners that will be checking this out want to have a good laugh, Google my name, DC resignation letter, and you'll get a copy of that, which was leaked to the press. And it's
All right.
funny. We were as a little bit of an explanation, we were asked by the mayor to write, a very simple 1 paragraph or 2 paragraph resignation letter. And I was like, screw that, like I've got a great
I'm gonna
team
write a
here. They did
novel.
great work. I
Right.
I wrote a novel.
Yeah.
This feels like it
So
feels like Tom Cruise putting the stuff in the in
exactly.
Now,
So that was
is
kind of
that
fun.
like a direct assumption, right? Because if quote unquote the other party takes over, there's not even a conversation. Like you're just gonna kind of polite. I mean, for the most
Sometimes
part.
there were, yeah, there were a couple people in that administration who were held over, but like literally two.
Yeah. Yeah.
right.
Because what happens is whenever a new politician is elected, it's their prerogative to fill the cabinet slots with people that they
Yeah.
want to
Yeah.
fill them with, and
Sure.
inevitably they're either people on the campaign or just people that they know or people who they think are better or what have you. So um, you know, it, overall, it was an amazing experience. Mayor Fenty was 36 years old when he was elected mayor of DC, and his whole thing was just like, let's get shit done. We were here for a limited period of time. There's a lot of stuff to do. I'm going to hire the best people I can find and just let them go.
Mm,
And he did that. And to be fair, like I was a weird hire. I was 33 at the time. I'd never done anything in government. I was just coming off of this startup, living in London, like never been in DC before. Like, what did I know? But
right.
it was great. Worked with amazing people. It was funny because when I told people I was taking that job, they thought I was crazy. They're like, "Wait, you're going from a startup to the government? Like
Yeah.
that's nuts. You're gonna have to deal with government bullshit." And
Brian,
and what was interesting.
I do
Oh,
have to say
sorry.
you changed quite a lot. Just for our viewers. Those stayed the
Thanks,
same.
Eugene.
So just I had
Thanks,
to do
Eugene. Really,
I
really appreciate that. Really appreciate that. I mean, I suppose anybody could do an internet search, and there are plenty of pictures of me out there, but
Yeah, exactly.
really, that's blushing a little bit. Anyway, what I found was that the people that were working in DC at the time were some of the best people I'd ever worked with. I mean, they were just, we were there until 9, 10 at night all the time, just plowing through stuff. The agency was super fun because we did technology for the entire city. So we were responsible for all of the IT, like all the basic stuff like networks and laptops and
Yeah.
all that. But we also did all of the tech for schools, police, fire, you name it. And so it was super, super interesting, and just had a blast going through all that. Anyway, I resigned from DC and then went to go work for Governor O'Malley in Maryland as the chief innovation officer for the state. And it was interesting because it was the first ever chief innovation officer title in the public sector in the US. And so that gave us a blank slate to kind of experiment with, and we had a good time with it. We did a lot of great stuff. Introduced a couple of bills into the legislature, which got passed. That was pretty fun. Worked with pretty much every agency across the state. Again, learned a ton. Met a lot of great people, and I was happily doing that job, and was planning on going back to the private sector after that ended. But sort of halfway through, was recruited by some folks at the White House and Secretary Sebelius at the Department of Health and Human Services. This is in the Obama administration, to be the chief technology officer for HHS. And before I'd started at Maryland, I promised myself that it would be the last government job I would ever do, and I would never, under any circumstances, go work for the federal government because it was so bureaucratic and crazy. But it was just really hard to pass up. The team there was just absolutely incredible. Some of the people I worked with, this is back in 2012 to 2015, they were literally some of the best people I have ever worked with. Some of my closest friends still today. There are some bonds that get forged in those fires
Of
that
course, yeah.
are pretty hard to break. And then and also, I mentioned earlier, my dad is a clinician. My uncle was a doc. My grandfather was a doc. So, sort of in my blood to a certain extent. And given the ACA and all the changes that were happening, it was just, yeah, I couldn't pass it up. So ended up going to do that. You know, Lots of great stories from that. If you guys remember, that was the time frame where we were launching healthcare.gov. So,
Oh, I was just Googling in the
Miami,
background when it was, because I remember the crazy
You
mess
launched.
and yeah.
October 1st, 2013. I will never forget that day. And I have about 1,000 stories that will rivet you for hours in terms of how all of that stuff actually went down and some of the interesting learnings from it. Probably requires a little bit of alcohol to get some of those stories out of me, but again, for your millions of listeners, if you ever see me and want to hear a good tale, buy me a beer, I'll tell you a story. Um,
Yeah.
but
Love the call to action. Very, very startup like.
exactly. So,
So you launched that. You launched that
yeah,
without a hitch.
we tried to launch that. It was interesting. And one of the things I will say is that once you get subpoenaed by Congress, there are very few things that can stress you out. So I feel like I'm
Right.
a pretty mellow person right now, mainly because I've had experiences like that where you learn how the politics
Right.
works and all that kind
Yeah.
of stuff. So anyway, left that role before Obama left office, and then did a few different things. Went to the Robert Wood Johnson Foundation as entrepreneur in residence. Really got a good education there about what the term equity, health equity, actually means. Before I was there, I didn't really understand the difference between equality and equity. They really kind of hammered that home, and that's a lesson I've kind of taken with me since then. So it was a very valuable one to learn. But simultaneously started doing some
Do you
angel
want to give
investing.
do you want to
Oh,
give
sorry.
us
Yeah.
a bit of a highlight here?
Yeah.
Just
The
peel the
equity versus
onion.
equality.
Yeah.
Sure,
Peel the onion
sure. I
one
mean,
layer.
so so one of the things we like to talk about a lot is equality, right? Like we say, okay, doesn't matter what color skin you have, it doesn't matter where you live, it doesn't matter what gender you are, everybody should be able to access care
Yeah.
and be healthy in an equal manner. What that doesn't really take into account is that personal circumstances dictate, um, generally speaking, different approaches and different responses. So to fast forward a little bit, one of the roles I did after that was at Kaiser Permanente. I was leading some work we were calling Medicaid transformation, and KP is a remarkable organization. I still to this day think it's the best healthcare that we can access in America. The on the clinical side, the incentives are all structured correctly. It's not about fee for service, right? It's true value-based care. Clinicians are free to make their own decisions, but if those decisions are not grounded in data, they will get sort of not necessarily a nasty gram, but a what are you doing here kind of
Mhm.
message.
Yep. Checked on.
And the clinicians really do pride themselves on doing the right thing by people. Now, one of those things that they is sort of an ingrained tenet at KP is that if you're a KP member, you're a KP member, and you get treated the same. It doesn't matter if you're the CEO of Kaiser Permanente or if you're somebody who's on Medicaid, or whose care is being paid for by Medicaid, and you happen to be in the Kaiser Medicaid plan.
Sounds
Um,
like sounds like France. I'm joking. I'm joking.
yes,
Yeah. No,
well,
no.
it's actually different, and I'll tell you why in a second. But the interesting thing about it is that this is where sort of the difference between equality and equity on the ground level really kind of struck me pretty hard, because when you become a KP member for the first time, the very first thing that happens is you get a letter in the mail that says, dear Bryan Sivak, welcome to the Kaiser family. This is your primary care physician. Please make an appointment and go see them at the medical office building as soon as possible. And, we'll do your physical. We'll figure out, what your
Right.
situation is. We'll get care plans, blah, blah, blah. That's great, except for the fact that it's not really as straightforward for some people to make an appointment in a medical office building, probably across town, with a primary care physician who might actually not look or act anything like you do, right? Um, and as a result, the that that to me is the difference between equity and equality. Like, they tried to make it
Yeah.
equal, but in doing so, made it inequitable, right?
Okay.
And so
So
one
in
of the
simple
things that we
terms, I'm from a different community, different background, and I'm being given a clinician that I don't feel I can trust, or they're just foreign to me. What's
That's
the
part of it. Yeah, that's part of it. But even the logistics of it, right? I mean, if you live, across
Okay.
town, if you're working two jobs, how do you get time off of work to actually go see a primary care doc who's working, let's just say 9 to 5, Monday through Friday, right?
Right.
In order to get cross town, maybe you got to take two buses or three buses to get there, right? I mean,
Right.
these are things that really need to be taken into account if you are going to provide an equitable type of care, right?
And do you think
Um,
that when they were designing that program to say, hey, go get your GP's visit, they were designing something that was for people that were kind of familiar to them? So it's like, oh, of course, someone can hop in a car and go a half hour and get time off from work.
no, I don't actually know, because one of the great things about KP is if they think about the populations, they will do things differently to make sure that things work
It
the
doesn't
right
happen.
way.
Yep.
But the I think the larger point is that the general concept was equality rather than equity, right?
Got it.
And that was the shift that we were trying to make there,
Right.
because
You
that
technically
would
have an
actually
appointment, but it's not actually equitable to you. You technically have the,
correct,
you're right. Yeah. Okay.
correct.
Got
And
it.
and to their credit, I mean, this was, like, KP really does try very hard to do all these things in the right way. I drank the Kool-Aid, and you can tell when I'm
Yeah.
talking about it, but there are just amazing people in that organization who try very, very, very hard to do the right thing.
And if I'm not wrong,
And
it's I think the largest health system in US now, right?
um,
The
well, I think
combobulation
it's
of it.
certainly the largest integrated payer provider, right? So the largest IDN. In terms of the largest health system, I'm not sure. I mean, maybe HCA has,
Okay.
more beds or what have you, but it is, I'm almost positive, the largest IDN. And I do, like I said earlier, I do think the best example of like high quality clinical care that we have, which by the way is reflected in all of their star ratings and HEDIS measures and
Mhm.
all that kind of stuff.
And Brian, just staying
Um,
on that for a second, just staying on that, do like, so one of the big things, obviously, I would love to hear about your French experience or European experience, but like, is from a cost perspective, do they get, I just don't know that, should know the answer to this, but do they perform better on an overall cost basis?
so that is a tricky question to answer. The I think the answer probably is yes, but um, the labor costs are pretty high. Obviously, the cost of running hospitals and other institutions is pretty significant.
Right.
Um, I think if you compare it to, sort of an individual getting care in a fragmented fee for service system, the answer is yes,
Okay.
100%. But it's not, one of the things that was always a little challenging was really figuring out what the true cost of something was
100%.
in a
Right.
system like that, right? Because
Yeah.
if you think about it, like, okay, so I'm paying some premiums as a member to KP in some way, shape, or form. But when I go to get care, how do you divvy up the cost of that care
Yeah.
that I'm receiving? Because,
Sure.
it's all capitated, right? Everybody's on salary and there's no per transaction fee, right? So it's not like you can say this thing costs this much in a really easy way. There's a lot of like hand waving
Mm,
you kind of have to do in order to figure that out.
sure.
I do think overall, if you compare the costs of that system to a traditional fee for service ecosystem in the US, it's going to be far less.
Okay.
Before we keep
Um,
going with your journey,
yeah.
because it's crazy. I think we can do this Tim Ferriss style because we're probably halfway through your but it's interesting. I just met, and I had to write her name down, and at ATA briefly, from Sama. So she was the Medicaid CMO in Arizona, and my chicken scratch, I can't even read it. But the reason I bring it up is, on stage she was talking about, she's using a system. So, when I think about a government, when I think about maybe military, yes, super advanced. But when I think about, DMV or any processes in healthcare, I think the technology is like ages ago. And that's what this woman, I think Salma was her name. She mentioned that they're still using a 40-plus-year-old system that's called Ideal, which is not ideal, right? So just the one question that I had for you, having some of these roles in the technology role, like how did you even look at this, right? Like again, I just don't think of government being an efficient modern system. And here's somebody who basically was the OG in NLP and
Right.
search, right? How does that, was it like a shock to
True
the
up.
system, or
Yeah.
my view is completely wrong of this?
So the thing that's important to realize about government is that the incentive system for, in particular, for career civil service employees is not designed at all to encourage coloring outside the lines. What I mean by that, everything's got a process, right? And if you, as a career civil service employee, follow that process, even if something doesn't work at the end of that process, you're not going to get in trouble because you did what you were supposed to do, right? You checked the boxes, you filed the reports, you did all the you did all
The
the things you're
TPS
supposed
reports, yeah.
to, in a way, kind of. And to be fair, like, everything in that system has a reason, right?
Yeah.
The unfortunate part is, like, a lot of these processes and rules and regulations were implemented because something broke at one point and somebody said, oh, we've got to fix that one thing, so here's
Yep.
a new process to make
Sure.
sure that doesn't happen again. But it's very rarely, if ever, the case that somebody goes back and says, okay, now we've got this massive set of things that we have to think about, what makes sense and what doesn't make sense. Nobody ever does that, right? So it just
Right.
kind of builds and builds and builds. um the On the flip side of that incentive structure is, if you do decide to color outside the lines, try something new. Let's say it works amazingly well, right? And like something that you did differently just changes the way the game works in some way, shape, or form.
You get your
Um,
enrollment right. You press the button and your enrollment comes through right away.
Yeah.
exactly, exactly. That's right. Um, if that happens, you might get a pat on the back. You might get a nice little commendation put
Right.
in your personnel file. You're certainly not going to get paid anymore, right? You're not going to get a
Right.
bonus. Um, and if it doesn't work, then you're in big trouble because you colored outside the lines, right?
Right.
So if you look at the sort of risk reward here, there really is no incentive for generally speaking, for a career civil service employee
To
to
take
take
risk.
those kinds of risks to do something different, which is why
Sure.
you end up seeing all of these kinds of things that have been around forever that never get changed, right?
Right.
It's part of the reason. Another part of the reason is that they work mostly, and when you start messing with it, it's one of those if it ain't broke kind of things.
Yeah.
Once you
Sure.
start messing with it, you have the opportunity to break it, and then there's politics involved, and people get upset, and
I think it's also fascinating too, is like this whole productivity dynamic of, it's not just about like taking risks, so to speak, but it's like, what are you actually doing in the hours of your day? Like how productive are you during the course of the day, and how much of your time do you have to spend tending to the system, really with maybe with good intentions and trying to do a good job, and how much time do you have, trying to be productive towards it? That it's such an interesting dynamic if the government gets too powerful and they're looking at the suppliers of innovation or suppliers of improved healthcare. If they're too
Yeah.
powerful, then they might wield that power unwieldy. And if they're not powerful enough, then they can't make decisions, right?
Yeah, I mean, all of that has to be taken into account, right? I mean, those are all factors in sort of the way things both work and the reason things end up being the way they are.
Mm,
Um, what's interesting is that on the political appointee side, there is some pressure to
get
do
shit done.
interesting and different things, right?
Yeah.
But as a political appointee, you're time limited, right? You're there for usually 2 years,
Yeah.
maybe four, maybe sometimes in rare
Right.
cases more than that. And because of that, you really don't have a lot of time and bandwidth to focus on more than a couple things. When people, I talk to people quite frequently who are considering taking jobs in government, and one of the things that I tell them always is when you go in, try to have an idea of three things that you want to accomplish and then
Right.
laser focus on those three things. I mean, you're going to
Pick
get
your
pulled into
battles.
other stuff, sure, but like
Yeah.
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 focus. Because if you don't focus, you're just not going to get anything done.
But isn't
Um, so
that feels like entrepreneurship too,
I
Eugene,
I
right?
was gonna
it is
say, right, because you really
100%.
can't. Yeah, you just it's always prioritizing the priorities, and you can never
Yeah,
ever 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 find time. You have to make it for what matters, right?
correct.
Yeah.
That's right. The
So
the most common piece of advice I give, and I have given over the past 25, 30 years to entrepreneurs or anybody really, but primarily entrepreneurs, is focus. By definition, an entrepreneur kind of like thinks like this, right? And quite often they'll solve a problem, even if it's not like totally solved, and then get bored and like go to the next thing. And if you do that, you're never going to build the company you want to build, right? Like you really need to just stay locked in and really achieve the goals that you've set out, and then you can move on to some of the other stuff. And that side of government is no different.
Mm,
sorry, I'm
um
just gonna
what
interject here. Actually, I think that's
Yeah,
an
yeah,
interesting point here because I think to me always the hardest thing is to say no, right? As entrepreneur, because there are things coming at
always,
you and etc.
always.
And if you're in politics, or just I'll put it broadly, right? Your job actually, it seems like you have to almost try to please everyone or as many people as you can, right? And so
right.
saying no,
I mean,
I just
sort of,
observationally.
Sure.
sort of. I mean, when you're in government, you're clearly working for an administration, right? And that administration has some specific goals that you're on the team to try to achieve. If you're on the legislative side, you've got your own goals that you're trying to achieve. And so, um, sometimes I would say those things intersect with, some
Mm,
segment. Actually, they always intersect with some segment of the population,
yeah,
but
sure.
especially in a country like the US with 350 million people or whatever it is, like you're never going to get a real majority for almost anything, right? So
Mm.
you kind of have to, again, pick your battles and figure out, where the ideology, the I don't know, the rubber of ideology meets the road of implementation. Really
We
torturing
The
get we
rubber,
get the
I
point.
love
but
Yeah, yeah, yeah.
the road of implementation, the rubber of ideology. It
some
sounds like
something like that. Something like
a
that.
class that
Jim, that
Eugene took.
sounds like a Google short right there. That a YouTube short right there.
It sounds
Cut
like a
out.
Right.
class that you took in like the, in your junior school.
That's right. That's right. So, it is really interesting though. And like I've got a bunch of great examples of where you know technology implementations, or policies that have good intentions, kind of ran aground when they didn't get updated, or things were not thought of, because once a law is passed, also it's really hard to change that law. And that's actually something that I think we forget sometimes. Like, the Constitution of the US was designed to be malleable, right? It was not designed to be updatable. And while there are some, sort of first principles that we all like to adhere to, like, the First Amendment, freedom of speech, like all that good stuff, um, as society changes and as technology changes society, those things really do need to be thought about. They do need to be amended. And so
100%.
like one simple example, something that actually I worked on both in Maryland and then in the federal government. So there were these systems that states were required to build to serve their population of foster kids. And in 1996, there was a law passed that and regulations written that essentially allocated federal match funding to the states to develop these systems if they develop them in a certain way, right? The details we could go into it, but it's not relevant. I think the most important thing to point out is that law and those regs were written in 1996, which is before anybody had cell phones and before iPads, before
Right.
iPhones, before any of this stuff. Really, like the internet was just kind of a baby at that point, right?
Yeah.
And so fast forward now to 2012, 2013, 2014, we're now dealing with these regulations that are just fundamentally archaic. And so one of the things that I actually did focus on and helped the team at the Administration for Children and Families do was essentially create a new set of regulations that took into account modern technology. And they built a framework, which is excellent, that allowed the federal match funding to be provided for systems that were more modular in nature, that were much less prescribed, but that could, use things like connecting to APIs and getting data out of different sources to actually do things in a different way.
Sure.
So it was, just an interesting example of how you can do things if you focus on those things.
In now, and not to, so right now, so you are you advising governments in France right now, or sorry to.
No, so we'll skip ahead a little bit. Now, I am actually we started my partner and I started a new early stage focused healthcare venture fund.
Okay.
We although the first part of this conversation is relevant because the thesis for the fund is actually directly connected to a lot of the time I spent in government, which is to say that um, a lot of venture investors, when they look at healthcare opportunities, will look at regulatory risk as part of their diligence. Is there
Sure.
something that is out there in regs or in the law that's going to prevent this company from being very successful? We actually take an opposite approach to that. We flip it on its head and we look for regulatory opportunity. Because what
Love it.
happens is whenever governments do something, they pass a new law, they write some regs, they issue guidance, inevitably they'll create tailwinds in these markets. And these
100%. Yeah.
tailwinds will, they can be very blatant tailwinds, like, the government dropping $38 billion to incentivize the adoption of electronic medical records.
Right.
Or they might be, less obvious, like literally a number changes, a single digit changes in a reg somewhere, which opens up a market to, a
Right.
million, 10 million more people, whatever.
Right. Right.
And so we look at all those things and we think that the way to build a portfolio that generates great returns is actually to look for those regulatory opportunities and invest behind those tailwinds into companies that are actively taking
Going after
advantage
that.
of them, could take advantage of them. Exactly. Um, and it turns out the nice side effect of that, I don't typically describe the fund as an impact fund because it just has a lot of baggage and, it
Sure.
is what it is. But, um, we've made 4 investments so far. And the really nice thing about it is that each of those 4 investments, and I suspect pretty much every one we will make because of the thesis, is really driving impact in the communities that they're serving in ways that you wouldn't have expected otherwise. And so um, it's been great to kind of start walking down this path and see where it goes. And we've been having a lot
It's
of fun.
brilliant. And is it are there a lot of this approach, or this kind of this focus on this approach? Are there a lot of funds like that, or is this quite unique, or how would you describe it?
There's some that um, you know, talk about regulatory stuff a little bit,
Tailwinds.
but
Yeah. Yeah.
no,
Yeah.
yeah, nobody, there's no other fund out there that I've seen that explicitly focuses on these regulatory
This is
opportunities.
yeah.
And
Yeah.
and
And I,
now
what?
And I'll
Go ahead.
interject just real quick. Having spoken to, I think, something like 130 plus VCs in the last couple of years. There are VCs that are pure healthcare investors that,
Yeah,
and I'm oversimplifying it, of course, but, if there's a CPT code, great, I'm in. And obviously there's more to it, but I'm oversimplifying it. And then there's, I'll say, kind of more maybe direct to consumer, well-being, wellness, right? And for companies that are kind of in between, so there might not be a CPT code yet, right? Yes, it's still at the
yeah,
end of the day is, are you making revenue? Are you driving change? Are you driving? But I found, when Bryan told me about his, is that actually the tailwind concept, I personally, in the, 140 plus funds, I haven't come across with this
yeah,
thesis.
yeah. And is that international, Brian, or is that U.S. focused?
Great question. So the second unique component or unique-ish component to what we're doing is that we're sourcing not just from the US, but also from we're sourcing globally with a preference for UK, Europe, and Israel.
Okay,
The, there are a couple of reasons why. First of all, most US-based healthcare funds will not invest outside of the US. I'm
sure.
sure, Eugene, you've seen this in a number of your conversations.
Yeah.
And so from that perspective, I think there's a pretty big greenfield opportunity and a lot of overlooked, great startups that that we could invest in. We do have a caveat, which is that any company we invest in must either be in the United States as part of their go-to-market or be coming to the United States as part of their go-to-market,
Okay,
which in healthcare is actually not a problem.
everyone wants
As
to
you
get to
guys know,
U.S.
Yeah.
exactly we spend
Yeah,
4.2 trillion, I think, now on healthcare in
yeah,
the US, and it's such a fragmented market that there's tons of opportunity. And when you're talking about smaller countries with, generally speaking, single payer systems, they are, you're kind of limited by the
yeah.
buying audience. And so almost every healthcare startup that I've seen will either get started in their local geography or they'll
Try to get there.
immediately go to the US. Exactly.
Yeah,
Yeah.
So for
yeah.
us, it's great. Yeah, yeah. I mean, for us, it's great because we can, first of all, valuations outside of the US are a lot lower. Companies
Sure.
tend to be much more capital efficient. So our entry points can be much more efficient for the fund itself. And then, the experience that we've built over the past 25, 30 years allows us to effectively bring these companies into the US, make the right introductions, kind of help them shape their strategy, which is going to be different, obviously, than coming from
Mm.
a different market. So, we think we've got a pretty good value prop from that perspective as well.
It's funny. I look at all the companies I built over the years, like with Point of Care, Eugene, like in
Yeah.
Health Beacon, they always the volumes always cracked when a regulatory event happened. Whether I was chasing that, like I might have had a generally useful, obviously we were creating value, what we perceived as valuable services with need. We were chasing commercial traction, but undoubtedly when some governmental switch flipped in most cases, that's what took us to like millions of euros of revenue, or, in the US, like a remote therapeutic monitoring codes, expanding their provision took us
Yeah.
into, now doctors would, the conversations went from, yeah, yeah, that sounds good, to like, I need to talk to you because, the
I
services,
mean,
I'm going to get paid.
yeah, I mean, Eugene, you're seeing this right now, right? I mean, some of the new health coaching stuff that CMS is doing creates a tailwind for your business, right?
Absolutely.
Um,
Yep.
and so this is
Now,
this is
now chasing
exactly
chasing these pilots, that's a whole other discussion that we probably have another hour. But
yeah,
but yes.
right. So
it,
so
it,
I mean, but that's exactly it. Sorry, go on.
No, I said it's noble. I agree with you on the impact comment. It's noble because if the governments take the time, like to make a change, a lot of times the system just doesn't move that fast. So if you're coming in funding that and inspiring people to go after that and giving people resources, then they're doing it for a reason. If there's some underserved class of patients, then I agree with you. It's a great way to impact.
Yeah, I mean, think about it this way. Whenever a change is made on the regulatory side or the legislative side, or guidance or what have you, it's primarily directed at the incumbent entities in the healthcare ecosystem, and those tend to be, big payers or just payers in general, provider groups, the people that, you know, have a lot of the money, a lot of the power in the system. But those organizations do not change quickly, right? And so it's really hard for a lot of them to kind of roll with those punches. And
Mm,
if you can't innovate in response to regulatory requirements that are coming out, what are you going to do? You're going to look to the startup ecosystem to help you handle those innovations, right?
mm,
And so, again, this is why we think that, sort of leveraging on this thesis will allow us to create that portfolio that, you know, if we make the right choices, will generate the returns that we're looking for. Plus, again, focus on those populations that, are pretty are pretty in need of the help in general.
So yeah, I think Jim alluded to this earlier. You're living in France now. Obviously, U.S. was your home for many, 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 many years. How do you compare the health systems? And I'll preface it with one quick thing. When I was living in U.S. and we moved to Netherlands, and I kind of kept hearing, you know, uh, European systems, positives and negatives. But what I found, at least in the Netherlands, was actually a relatively efficient system. And what I learned also, the Obama administration actually went out there to learn about the Dutch system at the time, and actually parts of the ACA was sort of embedded from the Netherlands. So that's a little preface. I've never experienced the French system. I have experienced now the Dutch, the German, and the Spanish, and we can have a whole episode on that alone. But I'll pass it to you, Bryan, on France.
So the French system really fascinates me in a lot of ways. So, um, we're generally pretty healthy people. We don't utilize a lot, but we've definitely been to the doctor and, had some things done and stuff like that. And and like any system, there are pros and cons. I think the big pros here are the cost. So all of the prices for everything is set by the state, right? So you know exactly how much something's going to cost when that thing happens. Um, the French government pays 70% of every charge. The other 30% is picked up by what's called the mutuelle. Think of it like an insurance company, but it's a lot cheaper. So for my family of four, I think I pay 250 euros a month for the mutuelle. That covers that 30%, but it also covers glasses, contact lenses, physical therapy,
right.
dental, whatever,
Yeah.
you name it. So your effective cost, my effective cost of healthcare is literally $250 or 250 euros a month.
Amazing.
And that's regardless of how much I use, right?
Mm,
But everything's cheaper. I mean, if I go get a prescription, it's like
Yeah.
€6, right? If I get a ultrasound or an MRI, it's like $25. It's like it's nothing. And so even if I didn't have, which I didn't for a little while, if I didn't have my carte vitale and I wasn't part of the system, if I go to the doctor, maybe I pay $40 for a doctor visit,
Right.
right? Maybe
right.
actually one time when we were visiting here in the summer, we had to take my daughter to the emergency room at night. It was not a big deal, but that I was ready for that bill. I was like, oh
Right.
man, that's
Hmm.
Right.
ridiculous because I don't have insurance here and all this stuff. Um, First of all, I did not have to pay anything before I left. Secondly, they sent the bill in the mail. I got it. It was like $82, right? I mean, it
Right.
was,
I
Yeah.
think
whatever it
like
was, it was nothing.
I did a trip to Bordeaux, recently. We did I did a weekend, I was telling you about Eugene and Bordeaux,
Yeah, I
and
remember that. Yeah.
someone gave us a whole lecture on, how much people make on average, and, education and healthcare and daycare, and, people are living these lives like, Hollywood stars on like 50 grand a year.
Yeah. Well, I mean, this is where the culture in France I find to be really fascinating, especially coming from the US. So let me just add one other thing on the healthcare system. The thing that I find fascinating and that I still haven't really figured out, but I think it relates to the comment I'm about to make, is that the system here is fee for service, right? You go see a doctor, you pay for that visit,
Yeah.
so there is theoretically the same incentives as in the US to do transactional, let's make as much money as we can medicine. But they don't. Like they don't, like if you go see a doctor,
Right.
and so actually a great example, I don't think my wife will be upset about me telling you this. So she tore her ACL. Um, and she tore her ACL while we were in the United States. And we got a few recommendations for people to talk to. He ended up one of our friends said, "Oh, call this doctor at Hospital for Special Surgery in New York. He's great. He'll give you a good idea." That call I think lasted maybe 18 minutes, and we got a bill for like $752. And the recommendation was, "When can I schedule you for surgery?"
Mm.
Um, Came back to France, saw a orthopedic surgeon who actually back down where I live, rugby is really big, and so this guy like does all the rugby players. Everybody's got a guy who does the sports guys, right? Um, so this guy does all the rugby players, and his advice was, don't do anything for 6 months, because you have no idea what's going on. I mean, I'm looking at your MRI, and I can tell you that it's a torn ACL, but don't do anything for 6 months. Go do physical therapy, right? And here's the
Mm.
physical therapy that you should do. I've got a great person I recommend. So, and by the way, all the physical therapy is obviously at no cost because the government picks it up.
Right.
So she does a lot of physical therapy. She goes 3 times a week. She's very diligent about it. She does a great job. 6 months later, she gets an MRI, which again is like $50. Um, Brings it to the doctor, and like the guy looks at the MRI and like almost falls out of his chair because her ACL had just like magically repaired itself. He's
And
like,
no,
this, yeah, he's like, this can happen. It doesn't happen very often. I really
yep.
haven't seen it happen, but you're good, And
Yeah, yeah,
so
yeah, yeah.
Right.
if we had
Right.
listened to, the HSS guy, like she would have been under
Yeah.
the knife, like lots of recovery, all kinds of crazy stuff. And now it's like normal
Yeah,
Yeah.
no one
ACL
got
again.
their cut like in the States of the surgery,
That's right.
No one got their
So
piece.
so this goes to what I'm about to say about the culture. And this is the thing that I've found really interesting. And actually, to be honest, I'm really happy that my kids are growing up here a little bit just to see sort of the difference, which is that I don't know how to put this the best way. I guess, people definitely want to earn money. They want to live a comfortable life, but they don't need more. You know,
Mm.
like once they get to a certain point where they can do all the things they want to do, and take vacations, and go eat out at restaurants, and do whatever it is that they want to do, they're good. And they
Right.
they like there's that trite saying, work to live, don't live to work.
Yeah.
And it is a little trite, but I do think that's kind of the way the culture generally speaking works
Oh,
here.
totally. Totally.
And so and so I think that's why people are not taking advantage of this transactional fee for service system the same way that we do in the US,
100%.
I think.
And I think it's
Yeah.
also one of these things, and we'll go to the question, Eugene, because I don't want to make you late for your call, but
Yeah.
I think
Yeah.
it's one
All
of those
good.
things. I think it's one of those things where there's like just a different culture and honor in it, and you can see the respect. Definitely in my experience, the way the French think about the health service and think about that is it kind of like how people in the UK think about the NHS. Just it's all part of an ecosystem that interacts with each other, and if you take advantage, you're fighting against the system. Um,
Yeah, yeah, yeah. I think that I think
Joyce.
that has a lot to do with it.
all
Yeah,
right,
I
so
was I,
we
was- I was I was gonna go to the last question, not to cut you off, Brian.
Okay,
We
so Brian, picture yourself after this, you've traveled the world, and now your fund has, is being you've got a call where you're asked to go back to Chicago to your alma mater and to speak because your fund has now been giving impact of the year award of all the possible venture funds, and you have a fleet of startups that have gone on to become massive companies driving equitable healthcare across America. And as part of that, and you're given the commencement speech, and your wife is joining you in the audience with a perfectly healed ACL. She had just ran a race, and you're in there, and you're given that talk, and there's a group of French people, wishing you on. And it was a young person comes across the audience who's about to take a job in the DC healthcare system, and you said, Bryan, I've got to talk to you. And you looked at that younger version of yourself. He's a young engineer, computer science major that had worked in the private sector and now moving into public. What's that one piece of advice you would give that younger version of yourself?
Well, going back to something I said earlier, pick the 3 things that you're interested in doing and focus on those 3 things. And I would also say, push the envelope, right? Like, don't be constrained by the rules and regulations. Some of them are there for a good reason, and understand which ones those are, but also understand which ones are archaic and need to be changed, and then find allies that who can use their positions to help you get those rules changed in the right way. We did a lot of that, and one of the things we built at HHS was this thing called the Idea Lab, where one of the things I realized pretty quickly is that I had no new ideas. If I had an idea, chances are very, very, very good that somebody else in the government had thought of it at some point, but was either not in a position to execute on it, or was too worried about what might happen if they did try to do it. And so the construct for this thing we built was basically to create a permission environment for people to actually execute on those ideas that they had always had, that they knew were good ideas, but they needed space to actually accomplish it. And so, those are really the things that I would say, because government in general, the constructs are not going to change, but you can change the constructs from the inside if you have a little bit of courage and you're thoughtful about how you do it. And so those are kind of the things I would say.
Merci.
Thank you for joining.
and
and for all those that got to the end here, click subscribe, follow along, and share it. See you next week.